And now, Wellness Wednesday, brought to you by Express Care Urgent Care Centers, a LifeBridge health partner.
Oh, we are here. It is Wellness Wednesday, and we're here with Jonathan Thierman, doctor, president of Express Care, and he's joining us to talk about some myths, some facts, COVID-19.
Yep, nice to be here.
Yeah, thank you for being here. As we were discussing, there's a lot of confusion right now sort of about vaccination, protocol. What would you say, and you did mention you're seeing cases rise right now, so what would you say sort of is the best way forward at this point?
Yeah, there's a lot of questions about COVID and COVID vaccines this year. So the biggest two questions I hear are, is it safe to get vaccinated and is it effective to get vaccinated? So the answer, we'll talk about safety first. The vaccine's been given out more than 14 billion times with a B. That's a lot. Yeah. And there really have been very few side effects, and it is very, very safe. It's also FDA approved now, fully FDA approved. It used to be an emergency use situation. Now it's fully FDA approved, and the indication is for 65 and older, and for 6 months and older with some underlying health condition that could make COVID potentially worse if you get COVID. And those conditions are things like obesity or diabetes, fairly common conditions. So there's a broad range of people that it's indicated for. I think the controversy came when the recommendation from the FDA was that the 6-month to 65-year-olds that were healthy should talk to their provider before they get it, to weigh the pluses and the minuses, the cost benefit. And I think that's a reasonable thing to do. I mean, you should do that whenever you get a vaccine or any sort of medicine. But there was concern that that would signal that it might not be safe. And the truth is it's extremely safe. There's a rare condition called myocarditis, which is inflammation of the heart. It happens about 3 times out of 100,000 people who get the vaccine, but it happens 20 times more if you get COVID. So it's a side effect. Everything has side effects, but it's more common if you get COVID, so it's better to prevent COVID. So it's largely safe. I think it's great to talk to your provider, and if you're in a higher risk group, I think it's great to get the vaccine.
Okay. We've heard the term mRNA lots of times. Lots of folks see it. I'm one of them. Sometimes you don't know what it means. Can you kind of break that down for us?
Yeah, sure. mRNA is a relatively new technology for creating vaccines. It's been around 15, 20 years in research and development. And it came out really in 2020 with COVID vaccine. It was the first vaccine utilizing this platform. It's a remarkable technology. It's opened the doors for a lot of other developments. And mostly it's remarkable because it allows us to make things very, very quickly. What it is, mRNA is a little snippet. It's like a blueprint for a protein. And it's something that is introduced into your body with the vaccine, and it goes into your cells, and it creates, you manufacture a protein that looks like the virus. And so it's the spike protein that they used to call the spike protein. It's a variant of the spike protein. You're making this protein, and your body's now seeing the protein. You're not getting any virus in you, but your body sees the protein. It's able to condition itself and be ready. If it does actually see the virus, it can recognize it, and it can form antibodies more quickly against the virus. Wow. So the important thing to know about the mRNA vaccines is that people worry about their DNA, and your DNA is tucked inside of your nucleus of your cells, and the mRNA goes nowhere near the nucleus of your cells. It does not touch your DNA. It just goes and makes this protein, which is a benign protein that gives you a little head start if you were to get sick with the virus later.
That's good to know.
Got you. Great clarification. Thank you so much, Dr. Thierman. We appreciate it.
Absolutely. Great to be here.
Thank you.
Wellness Wednesday on WJZ at 9 is brought to you by Express Care Urgent Care Centers, a LifeBridge health partner.